PSA is a protein that's made by cells in the prostate that is in very high concentration in semen. But when the prostate is diseased, either to non-cancerous enlargement or prostate cancer, the PSA leaks into the bloodstream and can be detected by a simple laboratory test. It's fair to say that most men who have what is generally considered to be an elevated or abnormal PSA actually have non-cancerous prostate enlargement and don't have prostate cancer. And that's led to some of the controversy about whether PSA screening on a routine basis for detecting cancer is useful. PSA, when elevated in the blood, does increase the risk of having prostate cancer, but there are other risk factors. Age and race and family history are important. And only a biopsy can determine the presence or absence of prostate cancer. With respect to routine PSA screening, there's a huge controversy based on differing interpretations of available data. On the one hand, there's the American Urological Association that suggests that men be offered a PSA beginning around age 40 to establish a baseline and then be followed over time, and that their doctors have a discussion with them about what the benefits and risks are. At the other end of the spectrum is a recent U.S. government agency, the Health Preventative Task Force, that recommended against PSA screening in any man, suggesting that routine PSA screening does not decrease mortality and that more men are harmed because of overtreatment of non-lethal cancers than are benefited by finding a potentially lethal cancer that can be cured. And there are a number of other organizations that have taken positions somewhere between those two extremes. The American Cancer Society is a little closer to the American Urological Association recommendation that a discussion be had with the patient about the benefits and downsides of PSA screening. The American Association of Family Physicians recommends routine screening in men over 75, but thinks it's reasonable to have that discussion with younger men. A PSA that's suggestive of cancer in an otherwise healthy man who has at least a 10-year life expectancy usually leads to a recommendation for a prostate biopsy, which is a simple outpatient procedure that takes about 10 or 15 minutes and is really the only way to determine whether or not a prostate cancer is present once the pathologist has the tissue from the biopsy to look at it under the microscope. After that, the PSA, the grade of the cancer on the biopsy, how much cancer there is on the biopsy, all go into a determination of how aggressive the cancer is and whether or not a recommendation for treatment is appropriate.